Good afternoon, everyone. I am Megan Hellman, and I would like to welcome you to our March webinar. Thanks so much for joining us today. We really appreciate your time. If you would like to mark your calendars, our next webinar will be on Wednesday, April 15th at noon Mountain Time. We hope you can join us. Key report packets were created for today's webinar and are available to access via the Client Document Library located under the Support tab in the InfoDive portal. As always, we do encourage you to ask questions during the webinar, so please feel free to pop a question into the box and we will answer these at the end. Please email providerclientservices@intrinsic.com or call the support line with any questions specific to your data. When you exit the webinar, please remember to rate our webinar on a scale of 5 down to 1. We appreciate any comments or topic ideas for further webinars. Our topic today is benchmarking reports, so let's dive in. As always, we will start with our disclaimer page. Not going to spend a lot of time on this like we normally don't, but just keep in mind that we do use blinded data, which means that all patient and provider identifiers have been given fictitious IDs and names in these reports that we're going to look at. We've got a lot of topics to cover, so let's go ahead and jump into that first slide. So the very first benchmark scenario that I really want to look at is going to be creating contracts around work RVUs. Now, I do understand that there are multiple ways that you can create a contract for a provider within the practice, but a lot of practices do rely on work RVUs to be a portion of the comp model, if not a very large portion of the comp model. So this very first scenario is going to be creating contracts around work RVUs and just some bullet points that you might want to keep in mind when you're reviewing benchmarks to ensure that you're getting accurate information to provide to those providers when you are renegotiating or even building a new contract for a new provider. So the first one's going to be benchmark the range of expected work RVUs. You can utilize benchmark reports to gather that information from both external and internal providers to really get a good range of where you want to see or where you want your providers to be. You can also look at the years in practice and determine accordingly. So you can pinpoint a specific time frame or benchmark that you want to look at as far as key performance indicators and really utilize the years of practice that that provider has attained. So if it's a new provider, obviously you're going to want to plan that there's going to be a potential ramp up time frame for those work RVUs. Whereas if it's an established provider, it could very well be that they already have a very large population of client or patients, that they're going to be working with. So maybe you might want to adjust that work RVU according to that. Make sure to include verbiage on regarding non-billable services, on-call hours, and clawbacks. Now, non-billable services are anything that you don't bill out as a claim. On-call hours, depending on whether your physician is a partner within the practice or an employee, you may want to differentiate between the two as to whether they get comped for that time they spend on call at the hospital. And then, of course, clawbacks. And no, this is not talking about the insurance clawbacks that we always get within medical practices. This is talking about if the work RVU amount that is set forth within the contract is not attained, is not reached, do you claw back some of that money? So just making sure that you're very clear and you're very precise in the verbiage within the contract is always beneficial when dealing with doing those contracts for your providers. Of course, determining if your comp formula will be built fully around work RVUs or if there will be a hybrid model. Just keeping in mind that in 2026, CMS did establish the efficiency adjustment of negative 2.5% for specific work RVUs. Make sure to note the expected number of work RVUs annually. Again, that kind of goes back to that clawbacks discussion that we just had. Ensuring the number of work RVUs that you expect to see annually within the contract is beneficial if you're really going to focus on that for your comp model or comp formula. Next one's going to be make sure to explicitly state whether you have a multiple or bilateral policy for work RVUs. This would be on top of any of the already established CMS guidelines when it comes to adjustments for multiple or bilaterals. But just to make sure that if there's anything specific that you want in that comp formula, that it is stated within the contract so there's no questions when it comes back to reevaluating or renegotiating at a future time. And then finally, ensure to include actual expected days worked or full-time hours expected in the contract's language. Most of the time when you have a new hire employee, you do state the expected work hours. It's no different for your physicians. If there is a time frame that you expect that physician to be in office doing procedures or seeing patients, it needs to be said with the contract itself. So these are just a few bullet points for scenario number one. We'll get into the reports here in just a minute in the portal, but just wanted to kind of give you a little bit of a rundown of some suggestions for when it comes to creating those contracts for your physicians. Okay, so scenario number two, excuse me, is going to be talking about ramp up volume on new patients. Now, most of the time, we're going to focus on ramp up volume for new providers, obviously, but these are just a few bullet points that I kind of came up with where you could utilize to really track those new patients over time and ensure that you're keeping the standard KPIs that you want to see. So the first thing is to set your KPIs, your key performance indicators. What are you trying to track? Are you tracking the total annual volume of new patients, the quarterly volume, total visits with the variance of the new patients, or maybe new patient to follow-up ratios? Whatever it is, keep that in mind. You need to establish your baseline. So obviously a new provider isn't going to have a baseline of how many new patients they have seen in the past. If it's a long-term provider and they are starting to, you know, dwindle in their new patients or struggling to get in new patients, look at their 3-year historic data and kind of set a baseline average from that. You can use the benchmark reports, and we'll look at a few of those as we get into the portal. And you can even assess the data within your own practice. So looking at those internal peers with the same specialty to kind of help give you guidelines as to where your other providers should be. You can use benchmarks to determine the gaps in the practice. So scheduling, how many days are they working? How many days are they in the office versus how much work RVUs are coming from surgical procedures? Time spent on patients, the complexity of the patient, all of those things can be benchmarked in order to determine what is the best way forward for the provider you're looking at. And then, of course, your next step would be to create a plan, work with their scheduler and their scribe, and even the provider to ensure that everybody has buy-in into the next steps. And then, of course, reevaluate as needed. So, again, just really making sure that you keep track of everything for those providers, ensure that they understand exactly where you're coming from and the expectations set forth will be beneficial for you in the long run when it comes to those reevaluation discussions. Sorry. So the third scenario is going to be charges and payments. Now, we're not going to spend a lot of time on this slide deck just because we already can establish what charges and payments do for a practice. Obviously, we need to ensure that the amount we're charging out is going to be beneficial for us, but also ensuring that we're getting those payments in to keep the doors open. So very first bullet point is going to be to gather that baseline data. Again, if it's a new provider, you're going to be establishing at baseline at 0. So the expectation is that there's really no set amount prior to them coming into the practice as to what the expectations are, but that's where benchmark data comes in. So we'll be able to take a look at the benchmark reports and really gather those baselines for those new providers. You can utilize a 12-month data for averages on the charges for an established provider. You can also use the benchmark data to kind of ensure that 12 months worth of current data for that provider is in line with those different quartiles within the benchmarking reports. So we'll take a look at that when we get into the portal. You can utilize net collection rate. So that's your total payments divided by allowed charges times 100%. Anything above a 95% is considered good. So we'll really look at the payments or the collections that we're receiving for those providers in the benchmark reports to ensure that we're really staying at that 95% net collection rate. You can also calculate allowed charges. So that's going to be your total charges minus your contractual adjustments. So just keep in mind that when you're looking at those to factor in those contractual adjustments, it's going to help to kind of keep those totals in line with what you would expect to see for each one of your providers. You can track average revenue per visit, which is also going to be helpful when it comes to your payments and knowing exactly what you're bringing in per visit for each provider. Utilizing the payer mix and contracts benchmarking within the portal can also help to kind of keep in line and ensure that your payer mix for each provider is kind of in line with all of those others within that specific specialty. Now, you can identify areas for improvement by tracking all of these things specifically in your coding, billing, or contract negotiations. And then we can even break it down by looking at your average payments by CPT code, which we can look at the newer CPT reports, which are in the benchmarking portion of the portal as well. And finally, we're going to act. So we're going to take what we see in that benchmarking data. We're going to take what we have calculated as far as our allowed charges or our average revenue per visit, and we're going to establish expectations with these providers. And of course, as always, we're going to go back and we're going to reconvene when necessary. So whether that be during a quarterly review or an annual review, we can still have all of this stuff that we have gathered in order to make accurate and precise expectations and set forth these expectations for those providers. All right, so the final scenario we're going to look at once we get over to the portal here in just a minute is going to be the benchmark scenario number 4, which is average payments by CPT or HCPCS codes. So we're going to establish those baselines. We can take 12 months worth of the top 10 performed CPT codes, whether that be surgical, your HCPCS, your radiology codes. You can decide on the KPI you want to track. We're going to categorize the data. So we're going to look at payer, provider, specialty, ensure that what we are looking at aligns with the provider that we are using. So again, just categorizing the data. We're going to use the Medicare physician fee schedule and other benchmarks to identify the standard, which we can do utilizing the HCPCS or CPT reports within the portal. You can even use the GPCI to account for regional variations. So keeping that in mind that you can still utilize all of the Medicare payment policies that are already in place. We can check the percent of Medicare by these CPTs, and you can pinpoint the specific outliers and use those codes for performance improvement. And then finally, just make sure that you're executing the plan and reconvening when necessary. I know I've said that on every single one of those scenarios, but it's so important to make sure that you and your providers are on the same page and that you touch base often so that they understand that the expectations you set forth for them wasn't just a one-time thing, that you want to continuously monitor and ensure that the expectations that you have for them continue to progress, continue to be reevaluated. But for now, those are all the scenarios I want to talk about. We're going to go ahead and hop over to the portal. Okay, so now that we are in the portal, the first thing I want to remind you is that there are reports that will be available on the slide deck when the webinar is over. So if you refer back to those, it will tell you all of the different portal paths of the reports that we're going to look at today. The very first report I want to touch base on, though, is the productivity report. Now, this isn't a typical benchmark report, but it is provider comparison with group averages. So it's going to look at those internal providers compared to other internal providers within the same specialty. So patients, visits, and RVUs. Going to go ahead and click into this one. It does take just that recent 12 months here. It's going to default to that when you're looking at the report. Now, it does default to all provider type, or sorry, all specialty types and provider type physician. So just keep that in mind when you're looking at this report. You can use the filters to narrow down to mid-level or resource if you want to, and you can use this to narrow down into specialties. So let's say we were looking at an orthopedic foot and ankle specialist. If you click onto that specialty, the report is obviously going to narrow itself down to whatever foot and ankle specialists or whatever specialty you choose within the practice. Of course, in this scenario, we only have one, so that's not really helpful. Let's try hip and joint instead. There should be 3 available doctors. Okay, so now what we have is the group average available to you for those 3 physicians, and it gives you all of the different metrics available for that specific specialty for your practice, which is really helpful when it comes to looking at different KPIs that you're trying to track for a specific doctor, especially if you are trying to increase volume for a new hire or maybe even or a doctor that's kind of fallen into a gap of not being able to really improve on their KPIs. So as you can see, Dr. Baker does have very low volume number for new patients, but his work RVUs are high compared to the other 2. So it could be that he's doing a lot more complex procedures where his work RVUs are higher for that specific purpose. You could dive into other reports to really get down into the nitty-gritty details, but this does give you that basic overview when you're talking about comparing internal providers. I wanted you guys to see this report because we don't talk about it very often in these webinars, and so I feel like it's a really good report to be able to track those internal dashboards. The next report I want to go to is going to be the productivity comparison report. When we click into here, it does have an asterisk by its name. That's just indicating that there are multiple views for this specific report. You'll see that the crosstabs across the top of the report are highlighted. It does default to the infusion metrics, so keep that in mind when you're coming in here to look at this report. Since we are in the blinded orthopedics account, I'm going to choose surgical metrics, but you can choose whatever crosstab works for your practice. Once we get into the report itself, you'll see that the filters across the top are defaulted to recent 12 and then provider type physician. All of the others are open to all values, but if you have a specific provider group that you're looking at or a specific specialty that you want to narrow this data down to, you can do so in the filters. For now, I'm going to go back to that example of the orthopedic surgery, hip and joint. That's going to give us those 3 doctors we just saw in the RVU report we looked at: Dr. Baker, Dr. Gamble, Dr. Robertson. Now what we have is just data for that specific specialty for not only your group average or practice averages, but you also have the InfoDive community as well. Looking at the report itself, you'll notice that there is highlighted right here in bold 86 providers in the benchmark. This indicates that in the InfoDive community, there are 86 providers total that have the specialty of surgery, orthopedic, hip, and joint. This is inclusive of these 3 providers. And the reason why I know this is because every one of these are marked as included. The indication for that, or the flag for that, is just saying, hey, out of those 86, 3 of those doctors are your doctors in the benchmark. If any of these were to mark as excluded, it would mean that they are not included in that total 86 number. Now, the breakout here that it's different than all of the other reports in the portal is going to be that it gives you those quartiles and the different breakouts for the benchmarks. You have the specialty average group and specialty average practice. You have group average, practice average, and then all of the benchmark median, means, and then the 4 quartiles below. The reason why you don't see a variance in between the specialty average group and specialty average practice and the group average and practice average is because there is no specific provider group selected for this specialty. If we were to have picked a specific provider group, these would be different because it's going to compare that specialty average group versus a specialty average practice. So it's going to take that provider group and it's going to say, hey, it's the same specialty as all of the other doctors in the practice with that same specialty, but we're only going to look at that one specific provider group. And that's what we're going to focus on for that specialty average group. And then the specialty average practice is going to say, let's look at all of those specialties within that practice itself. So it's really good to be able to compare those metrics. Now, if we're looking at it from a group average versus practice average, that indicates that it's taking all specialties within your group or within the provider group or all specialties within the entire practice. And again, we'll give you different numbers if you narrow down the data based off a provider group. Then coming below, you have your benchmark median and mean. And then you have the 10, 25th, 75th, and 90th percentiles when it comes to benchmark information. Keep in mind that if you are looking to compare and do contracts, you're going to want to look at every single one of those quartiles and not just focus on what the 90th percentile is. Sometimes it may be beneficial to look at where all of your other providers are lying within that 10th, 25th, 75th percentile and really go from there to make the best estimation for what you want to do within those contract negotiations or days worked, however you want to lay out the verbiage for that. You can sort this on, let's just say we want to see new patients. I do this sometimes because it lays it out a little bit easier for me, where you can actually see where the providers are lying within those quartiles from the benchmarking data. So you'll see that benchmark 90th percentile for new patients is 998. We will see that under the 75th percentile falls Terry Robertson. So not at the highest level for Dr. Robertson, but is very close to that 75th percentile at 618 versus a 749. And then the rest of those providers are going to fall a little bit lower. So Dr. Gamble sits above the 25th percentile, but below the 75th percentile. And then Dr. Baker actually falls below that 25th percentile and is very close to that 10th percentile when it comes to new patients. You can do the same thing for days worked or work RVUs, depending on how you want to utilize this report. Ultimately, it really is up to how you are going to utilize this information. If you are looking at how to effectively set the proper numbers for, let's say, days worked or new patients within a contract, it may be helpful to know that Dr. Baker is sitting very close to the 10th percentile when it comes to new patients. So it could be a discussion that you have to have with him that the expectation is over the next year, you expect to see him closer to the 25th or 50th percentile, or maybe even up to the 75th percentile as an expected kind of KPI for this annual time frame. So just one way to kind of utilize that productivity analysis report when it comes to benchmarking. The next report I want to go into is actually going to be the financial comparison charge detail report. Now, there are two different financial comparison reports. This one is going to be focused obviously on charges because it's the charge detail. Again, same filter options at the top. We are focused on the surgery, orthopedic, hip, and joint because that's what we were just looking at, trying to keep that kind of consistent throughout the reports. Now, it is set to the default view on the report itself, but this is going to give you that breakout for charges, payments, adjustments, and then it's going to give you over there on the right-hand side the percent of Medicare, percent charges closed, percent collection on charges, all of these different details that can help you to kind of evaluate where this person, where this provider sits within your group or the benchmarking when it comes to collection on charges. So a really great report if you're going to compare that percent of Medicare across the board, or if you're going to do any type of calculation when it comes to their charge amounts per year. Now, you can filter this down to different service periods. So if you wanted to go back in history to look at their charges year over year, you could see that. But for now, just looking at this report, knowing that it's available to you to where you can really compare when it comes to providers in the InfoDive community compared to other orthopedic, hip, and joint providers or whatever specialty you choose for this specific physician that you're looking at, just one way to use that benchmarking report. Again, you can sort like we just did in the previous report and really narrow down the information and see exactly where the providers are sitting with those charges, or if you want to look at the payments as well. On to the next report, we want to look at that payment detail report. Now, again, this has a lot more metrics available to you because it's going to show you the different CPT classes available and the payments associated with each one of those. So as you can see over here on the right-hand side, it really breaks down each one of those providers' payments associated with the Medicare established Medicare established CPT classes. So we've got the E&M class, we've got all of those payments associated with that. We have the HCPCS payments associated with any HCPCS codes, meds, radiology, surgical procedures. All of those are separated out for you on this report. So very beneficial when it comes to being able to do those group averages or even provider physician averages and ensure that the payments that they're receiving for the amount of those codes that they do annually lines up with all of the others in the benchmark community. Again, it does give you all of those benchmarking quartiles, so you can sort this and be able to see where they are sitting within that 10 to 90th percentile range and make accurate and effective decisions when it comes to those KPIs that you're setting for those specific providers. Now, this does give you all of the specialties that are available in the blinded data. If we want to see exactly what it looks like for the hip and joint, like we have been, you just narrow that filter down at the top, and that's where you're going to see that breakout for those three providers that we have listed for the orthopedic, hip, and joint. Again, there's 86 providers in the benchmark InfoDive community, which gives you a really well-rounded ability to see exactly where all of the other providers are sitting when it comes to those different payments via the CPT classes, percent of Medicare, the amount of charges zero paid, which is a beneficial thing because if you're trying to do an analysis on a provider that's been there a while, maybe they have a very high percentage of charges zero paid, something that you can utilize to go back and really track why they have so many zero paid charges. So another report that you can use to do those different scenarios that we talked about. Okay, two more reports that I want to focus on. This next one is going to be the provider production with under the single provider. So provider production by CPT. When we come into this report, it's a little bit different in the view. When you open it up, you're going to see that this is broken down by each specific provider. Now, what I want to do is I want to find one of the ones that we have done before. So we're going to go here and we're going to go to orthopedic, hip, and joint. That's going to give us those 3 different physicians here in the drop down option. And we're going to stick with Dr. Baker because Dr. Baker seems to be the problem child for this blinded data, right? He has the lowest number of new patients, although he did have a very high volume of work RVUs. It's always good to really start with the one that you might be able to really tweak those KPIs to help him benefit more annually. So now we have him loaded on this provider production by CPT. It does show you that providers in benchmark 86, so it's staying true to the previous reports that we have looked at. And now it's giving you a breakout of all of the codes that he has provided or he has done over the last 12 months. Now, coming over here, we will see benchmark providers performing services. So it's telling you out of those 86 providers, how many of those providers have performed that specific service. So you'll notice that quite a few of them, all 86 of them have done, which would be expected since it's orthopedic, hip, and joint. You would expect to see 27447s, which is a TKA or total knee arthroplasty, being performed by all of them. It does give you the percentage of breakdown for those providers. And then over here, it gives you the service lines for the provider that we are looking at versus the providers in the benchmark, and then the ones that are performing the service. So again, 376 27447s for Dr. Baker versus 239 service lines benchmarked. So again, that's just something to kind of look at when we're looking at all of these, which may indicate why his work RVUs are higher, slightly higher than that of the other 2 counterparts within the practice. Again, it also gives you the charges that are associated with each one of those different CPT codes and the charges in the benchmark. So you're really comparing apples to apples, specifically at a granular level based off of each one of those CPTs with description. Across the board, you have the charges per service line. So it's telling you the breakdown of each one of those service lines performed, as well as the charges per service line in the benchmark, payments benchmark, and all the way across to where you get to the total RVUs and the work RVUs. And now you can see exactly where that work RVU breaks down for Dr. Baker himself. So 4214 when it comes to the 27130, which is the total hip, 7370 when it comes to the 27447, which is the TKA, comparatively to the work RVU benchmark at slightly less on both of those, more so on the total knee than the total hip itself. So really good report to really get into that granular detail when it comes to CPT codes for those specific providers. One more report that I want to show you in here is going to be the practice benchmarks. And we're going to look at the practice production by service CPT. Now, this is similar in field to the last report we just looked at, except this is going to be as the practice as a whole instead of just the specific provider. Now, what we can do, it's got practice production by service CPT. You will notice that there are multiple options up here to be able to look at specific the viewpoint of this report specifically, but we're going to focus just on the practice production by CPT. Once we get here, you will notice that it breaks down all of the different CPT codes that we see within this specific practice. It's giving all practice specialties, so we could narrow it down to just orthopedic surgery if we wanted. We can even just pick the provider specialty. So let's stick with what we've been doing. We'll go to hip and joint because that's what we've been focusing on. The CPT classification are all of the eval and management, medicine codes, radiology, and surgical codes. So again, we can see that that gives us a breakdown of all of these. It does give you a list of the practice providers that are performing those specific CPTs versus the number of benchmark providers that are also performing those, and the number of practices that those providers in the benchmark are located in. So just for an explanation on that, the very first report or CPT you see, 2 of the practice providers with this specific specialty do this 20550. Out of the benchmark community, 47 providers do this specific procedure, 14 practices for those 47 providers. This tells you the service lines per FTE. So your practice, there's 20 service lines per full-time employee physician. Mode number is 1, the median is 3, so it's giving you the low versus the high number of those service lines. And then it even breaks down charges per service line, payments per service line, your paid percent of Medicare. Service line 0 paid, you have your practice, the mode and the median on both the service line 0 paid, the RVU adjustment, total RVU per FTE, and then finally your work RVU per FTE. Now keep in mind that this is a very large report, so you might want to take this a little bit smaller so you can see it all instead of having to scroll in the scroll bar below. But it does really give you a good amount of metrics to be able to see by your practice how you are faring to all of the other practices within the benchmark community. And unfortunately, that does bring us to the full 30 minutes today. I apologize for going all the way to the very end. There are a few questions in